Hello, and today we're discussing spironolactone, or Spiro as we call it in the biz. We prescribe spironolactone all day. It's a great medication. We normally prescribe it for hormonal acne for women, but we use it for hair loss. We use it for HS or hidradenitis suppurativa. We use it for a few conditions, but today we're talking female pattern hair loss. We're going to go over the basics, what forms of it you can take, what are common doses, to take it, what are common side effects, what are uncommon side effects, what monitoring we have to do when you're on it, what precautions do you have to take, should you get pregnant when you're on Spiro? The answer is no. Brand names of spironolactone, and what to do if you forget a dose. So, first things first, basics. Spironolactone was developed in the 1950s and it was developed as a diuretic, so it makes you pee more easily. What conditions does it treat normally? Well, it can treat fluid buildup due to cirrhosis or liver scarring. It can treat fluid buildup due to heart failure, or fluid buildup due to high blood pressure. They found, though, that when they were administering the medication, it had this weird side effect of reducing male hormones. So now we use it today to treat conditions that are caused by high male hormones. What conditions are those? Female pattern hair loss, hormonal acne, polycystic ovarian syndrome, PCOS. So we're technically using it off label, meaning that it's not FDA approved for female pattern hair loss, but we've been using it for many, many years. Very common and very safe. What forms of Spiro does it come in? It can come in tablets, it can come in liquid, and it can come in a cream form, which actually I didn't even know until I started working on this. Um, in terms of common doses, it's normally about 50 to 200 milligrams per day, usually once or twice a day. We always start at the low end, usually 25 milligrams twice a day, just to get your body acclimated to it. And then we adjust based on how you're responding and what side effects you may be having. So, how to take easy plus minus food, take the same time every day. If you do take it at night, since it's a diuretic, you may have to pee during the night. So, in that case, you may want to take it in the morning. Common side effects. So, we're intervening in the hormonal system. So, things like irregular periods or breast tenderness may occur. Also, fatigue, dizziness. Um, Especially young women taking spironolactone, blood pressure tends to run low in young women anyway, and then you're taking something that may further lower your blood pressure. So you just have to be careful. Rare side effects, very, very high potassium. This is very rare. I've never seen it. It's usually for older people who are on multiple medications that may increase their potassium or if they have kidney dysfunction. Monitoring, if you're on spironolactone, what do we monitor? We monitor your blood work. We might order a potassium for you, especially if you're on a high dose or if you've been on it for a while. We also monitor your blood pressure just to make sure it's not getting too low. So, what should you do if you're on Spiro? Stay hydrated, lots of water. Let your physician know if you take potassium supplements or if you have a weird diet that consists of so much potassium. Let them know and use effective contraception as well. And as you may know, avoid sudden position changes. So, if you're laying down and you get up really quickly, you may feel faint or dizzy. So just be sure that you're looking out for that. Pregnancy, do not get pregnant on spironolactone. Since it's intervening in reducing male hormones, if you are pregnant with a male fetus, then it can cause a lot of damage to the male fetus. So you're not going to get pregnant at all on spironolactone. Are there brand names of Spiro? There's aldactone that's mostly well known and widely used. There's another one, Caraspir. I've never heard of that before, but it's a liquid form. Um, I think that's for older people when they're taking it for like heart failure and stuff. Um, so if you forgot a dose, don't double up. Just take it when you remember it, and you can skip it if you're close to the next dose. And that is spironolactone.